The other one, landmark, if you draw an imaginary line just passing in between, in the center of the clavicle over here, that is over here, that is here, just medial to the nipple here. This is called as a mid-clavicular line, right? The mid-clavicular line, the mid-axillary line, anterior axillary fold, the posterior axillary fold, then clavicle over here, suprasternal notch, over here this is the supraclavicular fossa, and over here this is called as the infraclavicular fossa. ठीक है? और infraclavicular fossa में आपको, you can see this groove over here in this region. This is called the deltopectoral groove, right? Deltopectoral groove. Its name is representing that is present between the pectoralis major muscle and the deltoid muscle. This is a deltoid muscle. ठीक है? That is called the deltopectoral groove. Is it clear? And over here you can see this infraclavicular fossa. It is basically a triangular depression over this region. ठीक है? ये triangular depression है इस region में. ठीक है? And this triangular depression, it is bounded superiorly by the, you can see, superiorly by the clavicle, right? And medially by the lateral border of the pectoralis major, and laterally by the medial border of the deltoid muscle. Over here you can see, right? So the infraclavicular fossa is basically, it is also called as the deltopectoral triangle. Okay? Infraclavicular fossa, it is also named as the deltopectoral triangle, which is bounded superiorly by this clavicle, medially by the lateral border of the pectoralis major muscle, and then the laterally by the medial border of the deltoid muscle. Is it clear?
Deltoid muscle.
ठीक है जी, कोई प्रॉब्लम तो नहीं है जी, यहाँ तक एवरीथिंग इज क्लियर. ठीक है, नाउ यू कैन टेल ना कि सुप्राक्लेविकुलर फोसा क्या होता है, इंफ्रा क्या होता है जी, इंफ्राक्लेविकुलर फोसा, एनीबॉडी कैन टेल मी व्हाट इज द फोसा, द डिप्रेशन. ठीक है, कहाँ पे होता है ये, इंफ्राक्लेविकुलर, रिप्रेजेंटिंग बिलो द क्लेविकल. इट्स अ फोसा और द डिप्रेशन बिलो द क्लेविकल. इज इट क्लियर?
जी.
ओके, नाउ द सुपरफिशियल फेशिया जी. ठीक है, as I told you before, हम किसी भी रीजन को पढ़ेंगे तो we start from the skin. स्किन के ऊपर जो लैंडमार्क्स हैं हमने उसको देख लिया है, right? Now after the skin, if you are going to remove the skin, we will be coming across with the superficial fascia. ठीक है जी. And what is superficial fascia जी? Anybody can tell me? Superficial fascia. जल्दी जल्दी बात करें यार, टाइम नहीं है, प्लीज डोंट वेस्ट द टाइम. सुपरफिशियल फेशिया क्या होता है? इसे सबक्यूटेनियस टिश्यू ना यार. बिलो द स्किन क्या होता है? सबक्यूटेनियस, राइट? सो सुपरफिशियल फेशिया इज द सबक्यूटेनियस टिश्यू, राइट? Subcutaneous tissue, and that subcutaneous tissue is made up of the loose areolar tissue with the varying amount of the fat. ठीक है, loose areolar tissue होता है, ठीक है, that is having the varying amount of the fat. So here you can see this is the superficial fascia of this region, of the pectoral region, and here you can see it's laden with the fat, and as I told you that the superficial fascia is what it is. The superficial fascia क्या होता है बच्चे? इसमें क्या चीज ट्रैवल करती है? क्या बात है, सो रहे हैं सारे? हेलो, बात नहीं कर रहे बच्चे, क्या बात है? हेलो, द सुपरफिशियल फेशिया में कौन से स्ट्रक्चर्स रन करते हैं? तो आज किधर गए ये सुफियान और ये सब लोग? हाँ, कोई नहीं आज बात कर. क्या
सर यहीं पर ही है.
कौन, हुज़ैफा बात कर रहा है? कौन बात कर रहा है?
सुफियान बात कर रहा हूँ सर, मैं यहीं हूँ. क्या
बात है सुफियान, आवाज नहीं आ रही आज, तुम्हारी आवाज नहीं आ रही, भूल गए सारा कुछ? सुपरफिशियल फेशिया
नहीं सर, वो कहते हैं कि वो क्लास में कहते हैं कि जो है ना इससे डिस्टॉर्शन होती है और बहुत प्रॉब्लम होती है सवाल पूछने से, तो चुप रह के सुन रहा हूँ सर.
नहीं बेटे, अब आपसे मैं क्वेश्चन करता हूँ, आप मुझे बताते हैं, मुझे एटलीस्ट ये पता चलता है कि आप लोग पार्टिसिपेट कर रहे हैं, आप समझ रहे हैं. ठीक है ना? ठीक है. डिस्टॉर्शन में उन लोगों के लिए मैं कहता हूँ जो जिनके मतलब कोई बातें कर रहे होते हैं और बातों की आवाजें आ रही होती हैं, दैट्स ऐसे कि अपना माइक ऑफ करते हैं. आप बेशक अपने माइक ओपन रखिए, अपने माइक, ठीक है ना, सो दैट वी कैन कम्युनिकेट. मैंने आपको बताया था ना, दिस इज म्यूचुअल डिस्कशन. ठीक है, कुछ मैं आपसे सीखता हूँ, कुछ आप मुझसे सीखें. ठीक है, Okay. So over here क्या होता है superficial fascia में क्या चीज travel करती है बच्चा?
So arteries, veins, and lymph vessels.
Perforating artery.
तो इसमें nerves, cutaneous nerves and vessels, ठीक है बेटा? The cutaneous nerves and the cutaneous vessels, ठीक है? Cutaneous nerves run करेंगी और cutaneous vessels करेंगी, ठीक है? Of course, they are coming from the deeper area, ठीक है? Deeper structure से nerves जब आती हैं, they are going to divide into the, to form the cutaneous nerves, and these cutaneous nerves are going to pierce the superficial fascia, and they are going to supply the skin. ऐसा ही है ना? Cutaneous nerve किसकी supply है? Skin की supply है, right? So it consists of what? The cutaneous nerves. बट जिनको माइक डिस्ट्रक्शन कर रहे हैं वो अपने माइक बंद कर दें. Okay, so we have got the cutaneous nerves and the cutaneous vessels, and in this region we got another muscle that is called as a platysma, a superficial muscle. ठीक है, यहाँ पे एक superficial muscle है that is called as a platysma. Okay, just show you. Here, you see this broad sheet. Platysma is basically a Greek word which means the broad. So it's a broad sheet of the muscles, right? Which is getting origin from the deep fascia. ये आपको नीचे नजर आ रहा है यहाँ और है. This is the investing layer of deep cervical fascia, and this is the fascia of the pectoral region, the pectoral fascia और ये deltoid का fascia, ठीक है? So this muscle getting origin from the pectoral fascia and the deltoid fascia. So it's a superficial muscle, right? So इस region में, in the upper part of this pectoral region, in the superficial fascia, we got this muscle also, the platysma. So when we talk about the contents of the superficial fascia, ठीक है, तो क्या क्या होगा जी? Number 1, the cutaneous nerves. Number 2, we have got the क्या होगा जी? Cutaneous vessels. Then the platysma muscle.
Superficial muscle.
Platysma.
Right. And also the most important structure present in the males, especially in the females, that is the breast. ठीक है जी? So the superficial fascia of the pectoral region. Here you can see the superficial fascia of the pectoral region. It consists of these are the cutaneous nerves. These are the cutaneous vessels. You see the cutaneous vessels in this region, and this is the breast tissue. यहाँ पे मैंने आपको मसल दिखाया था जो यहाँ से originate कर रहा था, that is a platysma. So when we talk about the structures present in the superficial fascia, तो हमारे पास कितने structures होंगे बेटे? We have got the 5 structures. Number 1, the cutaneous nerves. Number 2, the cutaneous vessels. Number 3, platysma. Number 4, breast, and the number 5 is the lymphatics. ठीक है, जो कि नजर नहीं आती हैं. Okay, here you can see over this in this picture. You can see this network of the small vessels. And these are what? These are called the lymphatics, the small channels which carry the lymph. Is it clear? And you can see
yes,
these are the lymph nodes. यहाँ से जो lymph निकल रहे हैं, these are going towards these lymph nodes. ठीक है, इन lymph nodes में जा रहे हैं xilla. Is it clear? So when we talk about the superficial fascia, हमारे पास 5 structure है. कौन कौन से हैं जी? The cutaneous nerves, the cutaneous vessels, we have got the platysma, we have got the breast tissue, and we have got the lymphatics.
Platysma, breast.
ठीक है, ये 5 structures हैं. But all these structures are embedded where? These are embedded laden with the fat. ये fat के अंदर जो है ना present. Is it clear जी? Okay. Now first of all we'll talk about the cutaneous nerves. Okay, when we are going to talk about the cutaneous nerves, the cutaneous innervation of the cutaneous innervation of the pectoral region. Okay, for that very purpose, the cutaneous innervation of the pectoral region, we are going to divide the pectoral region into the 2 parts, the upper pectoral region and the lower pectoral region. How are we going to divide it? The region between the clavicle and the, if you draw an imaginary line at the sternal angle, sternal angle से आप एक imaginary horizontal line draw करें इस तरह, ठीक है जी? So this part, this upper part, that is called as the upper pectoral region, right? Is it clear? Between the clavicle and the sternal angle, this region, this is called as the upper pectoral region, and below this one, from 2nd to 6th rib, that is the lower pectoral region. Is it clear? ठीक है जी?
जी सर.
Right. So pectoral region is divided into the 2 parts: the upper pectoral region between the clavicle and the sternal angle, that is the upper pectoral region, and the lower pectoral region between the 2nd to the 6th rib, that is the lower pectoral region. Okay. The upper pectoral region, it is supplied by the nerve that is called as a supraclavicular nerve. आपको याद है जी मैंने बताई थी सुपर क्लेविकुलर नर्व्स किस जगह बताई थी? Anybody who remember that one? Well, the supraclavicular nerves, these are the branches of the cervical plexus. ठीक है, supraclavicular nerve किसकी branch है जी? Cervical plexus की branch है. Okay, just show you. What is the cervical plexus? Plexus क्या होता है जी? What is the plexus? चलो ये बताएं. जल्दी जल्दी टाइम नहीं है बेटे.
नेटवर्क ऑफ नर्व्स है जहाँ से नर्व्स मिलती हैं और अराइज करती हैं.
नेटवर्क ऑफ नर्व
Right. So it's a network of the
Arteries
nerves. ठीक है?
together.
That are going to form the certain plexus to spare the muscular region in that specific area. और कितने plexus बने होते हैं? Cervical plexus होता है for the neck region. Then the brachial plexus होता है for the upper limb, the lumbar plexus and the sacral plexus. ठीक है? So the cervical plexus is formed by the anterior primary rami of C1 से C4. C1, C2, C3 and C4. They are going to join each other and going to form this plexus that is called as the cervical plexus. ठीक है जी? Now the supraclavicular nerve. The supraclavicular nerve is formed by the C3. As you can see, this C3 here and the C4. C3 and C4 join each other and is going to form a supraclavicular nerve, right? And that supraclavicular nerve, it is just going to divide into the the medial one, the intermediate and the lateral supraclavicular nerve. Is it clear? You see how the supraclavicular nerves are formed? By the branches of the C3 and C4 join each other and are going to form the supraclavicular nerve. Is it clear? Right? And that supraclavicular nerve, here you can see that supraclavicular nerves, they will leave the cervical plexus, okay, and they will emerge in the neck behind the posterior border of the sternocleidomastoid. You see this sternocleidomastoid muscle, ठीक है, इसके posterior border से निकल रही है. This one, you can see this one coming from the posterior border of the sternocleidomastoid muscle. In this area, that is called as a posterior triangle. You see this triangular area behind the, you see sternocleidomastoid muscle is going to divide that neck into the two triangles. The one anterior one, that is the anterior triangle, and this one, that is a posterior triangle. ठीक है जी? So this nerve, the supraclavicular nerve, that they are coming behind the posterior border of sternocleidomastoid muscle in the posterior triangle of the neck, right? At this stage, it is the deeper one, and it is lying behind the, you see this whitish thing. This is the deep cervical fascia. ठीक है? Deep fascia के नीचे है और ऊपर से इसके ये प्लेटिज्मा भी गुजरा है, हमने ये काटा हुआ, right? That has been cut from here. So it is lying deep to the deep cervical fascia and the platysma. And when it will reach near the, clavicle, it is going to pierce through these two structures, right? And become superficial or the cutaneous. And then it will enter, you can see that it is going to enter the chest by passing above the clavicle. ठीक है जी? Here you can see that it is going to enter the pectoral region, upper pectoral region by passing it above the clavicle. ठीक है ना? And then it is going to supply the upper pectoral region. Here you can see the medial supraclavicular nerve, the intermediate supraclavicular nerve, and the lateral supraclavicular nerve, right? The medial one is going to supply the region between the sternum and the mid clavicle. I told you the mid clavicular line. क्या होती है mid clavicular line? That is passing through the middle of the clavicle. It's a vertical imaginary plane. Vertical imaginary line or the plane which passes from the middle of the clavicle, just passes behind, just close, just medial to the nipple, right? And its distance कितना होता है जी? It is about more or less 9 centimeters from the mid sternal line. आपको जो median plane है ना, what is the median sagittal plane? Median sagittal plane से ये it is about 9 centimeters, 9 to 10 centimeters. Is it clear जी? Right? Yes. So this medial supraclavicular line, nerve is going to supply the region between the sternum up to the mid-clavicular line. The intermediate from the mid-clavicular line is going to supply the region over here up to the, the upper part of the pectoral region over here, and adjoining part of the anterior aspect of the, a bit of the, this shoulder region, the deltoid over there. Delta pectoral. You can say from the mid-clavicular line to the delta pectoral groove in this, right? And the other one, the lateral one, it is going to supply the upper part of the deltoid over here and the posterior aspect of the deltoid. ठीक है ना? हमने आपको ये अभी याद है कि मैंने आपको ये कहाँ पढ़ाया था? In the fracture of the lateral one third of the clavicle क्या होता है, क्या चीज डैमेज होती है? When we are going, yes, this part, this one, the little branch, ये damage होती है, and we can feel the numbness in this region. I told you, no, in the upper and the posterior part of the shoulder, you can feel the numbness if this nerve is destroyed. Is it clear?
जी सर.
कोई प्रॉब्लम तो नहीं है बच्चे?
नहीं.
Okay जी. No, we'll talk about the lower region. ठीक है जी, आपको जो lower chest है, lower pectoral region. This lower pectoral region, I told you, just below the level of what? Level of the sternal angle, that is from the C2 to C6. Sorry, T2 to T6. ठीक है? Okay. Now this area is supplied by the intercostal nerves. ठीक है जी? Intercostal nerves का आइडिया है बेटे आप लोगों को? Intercostal nerves का कोई आइडिया है जी? Intercostal nerves are basically, beta, these are the nerves, as I told you, that we have got the spinal nerves. ठीक है, spinal nerves आ रही है ना, मैंने कहा था, the spinal nerves के कितने पेयर होते हैं जी? 31 पेयर होते हैं. 8 in the cervical region, 12 in the thoracic region. ठीक है, 5 lumbar, 5 sacral and 1 coccygeal. याद है आप सबको, ये मैंने बताया था, right? So these intercostal nerves, these are basically the thoracic spinal nerves. ठीक है, these are coming from the anterior rami, anterior or the ventral division of the thoracic spinal nerve. From the, you can see this T1, T2, T3, and these are from T1 to T12, T11. ठीक है, the 12th one is called as the subcostal nerve. मैंने आपको बताया था ना? Hello, are you there?
Yes, sir.
जी सर.
बट ऐसे yes sir नहीं कहना, अगर confusion you can ask me straight away right now. ठीक है, मुझसे पूछ लें आप. ठीक है, I told you कि ये आपकी spinal cord है ना, इससे आपकी ये spinal nerves निकल रही है, right? So in the neck region we have got the 8 spinal nerves. These are called the 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. ठीक है, 31 pairs of spinal nerve, right? So these the intercostal nerves, these are basically coming from the anterior division of the thoracic spinal nerves. ठीक है जी, T1 से लेके T11 तक, and these are running just below the corresponding ribs. ठीक है जी, ये जो है अपनी corresponding ribs के साथ रन कर रहे हैं. You can see. Is it clear जी? कोई प्रॉब्लम तो नहीं है बच्चे? ठीक है, and these are running over, you can see, these are running, these are coming from the posterior aspect, vertebral column से आ रही हैं, तो ये posterior aspect से nerves निकल रही है, right? And these nerves, these are accompanied by their vessels. ठीक है, इसके साथ blood vessels भी run कर रही होती हैं. Well, we'll talk about it later. So these spinal nerves, so this from T2 to T6, these are going to supply the, just show you. Okay. Okay. So this part, the lower part is supplied by the, you see, these are the intercostal nerves which are coming out from the anterior chest wall. So these intercostal nerves, as they emerge from the, here, एक minute, I'll let you know. I just want to show you something. Okay. Okay. Now here you can see, this is what, this is a transverse section. ठीक है, ये transverse section है anterior chest wall का, also chest wall का. Here you can see, this is a vertebral column और यहाँ से ये nerve निकल रही है, right? This is what? This is the intercostal nerve, right? So suppose it's T2, ठीक है? Suppose T2. So it's coming over here. So it is running along the lower border of the corresponding rib. ये अपनी rib देखिए, it's running along the lower border of the corresponding ribs. Right over here, you can see this one, and it passes through this over here along the posterior chest wall, and when it will reach at the lateral aspect of the chest wall, it is going to give a branch that is called the lateral cutaneous branch. ठीक है, जब lateral chest wall पे आएगी, so it is going to give the lateral cutaneous branch, and then it is continuous running anteriorly below the rib. ठीक है, and when it will reach over here, it is going, that is basically coming from the main trunk, that is the anterior cutaneous branch. So the spinal nerves, these are going to supply the pectoral region by the lateral cutaneous branches and the anterior cutaneous branches. Is it clear जी? आपको pathway पता चला? ठीक है? This nerve, it is running, coming out from the, at the posterior aspect of the chest wall and runs below the lower margin of the rib, and then when it will reach at the lateral aspect of the chest wall, it is going to give a branch that is called as a lateral cutaneous branch, and then it will run again in the below the rib over here and reaches the anterior aspect of the chest wall, and here it is going to give the anterior cutaneous branch. Is it clear? The pectoral region is supplied by the lateral cutaneous branches and the anterior cutaneous branches of the spinal nerves, corresponding spinal nerve. Is it clear, जी?
Yes, sir.
बेटे कोई कंफ्यूजन है तो मुझसे पूछ सकते हैं आप, right? Okay, over here you can see now this lower part of the chest wall, it is supplied by these are the anterior cutaneous branches of the spinal nerves from T2 to T6. Clear? ठीक है? And on the lateral aspect you can see this lateral cutaneous branch from T3 to T6. ठीक है जी? T3 से lateral aspect पे जो आपकी lateral cutaneous branches आ रही हैं, these are T3 to T6, whereas on the anterior aspect these are the T2 to T6. Is it clear? So this part is supplied by the lower part is supplied by the lateral cutaneous branches and the anterior cutaneous branches. आपने मुझसे क्वेश्चन नहीं किया जी? आप you didn't ask me a question. Okay, where is the lateral cutaneous branch of the T2? Nobody asked me. जाग रहे हो सो रहे हो? सुफियान, हुज़ैफा?
सर जाग रहे हैं।
तो क्वेश्चन क्यों नहीं
खुली
किया?
आंखों से सो रहे हैं।
खुली आंखों से सो रहे हो?
सर बता दें।
अच्छा, मैंने क्वेश्चन किया, मैं ही बता दूं। Why don't you look for that answer by yourself? हाँ?
सर कल हम देख के बता देंगे आपको।
देख के बता दें।
सर आर्मपिट की वजह से।
Okay, I just share you. Okay, look at this one. बेटा T2 जो है उसकी जो lateral cutaneous branch है, that is called as the intercostal brachial nerve, and it is the branch which is not going to supply the the lateral aspect of the chest wall. It is going to supply the medial aspect of the upper part of the arm. Here you can see this one. This is the lateral cutaneous branch of the T2 that is called as the intercostal brachial nerve. ठीक है? And this branch, it is responsible basically for the the referred pain of the coronary artery disease to the medial aspect of the upper arm. ठीक है जी? Is it clear? ठीक है? हम कहते हैं ना जी, किसी पेशेंट को हार्ट अटैक होता है, चेस्ट पेन है, एंजाइना है या कोई कोरोनरी आर्टरी डिजीज है, हार्ट की जो पेन है एक लेमन लैंग्वेज में, राइट, इट ट्रेवल्स अलोंग द मीडियल एस्पेक्ट ऑफ द आर्म अप टू द medial aspect of the arm up to the finger tips of your toes or tips of your little finger and the index finger. ठीक है? तो आपकी जो medial aspect of the arm के साथ ये पेन रन करती है. If a patient comes to you and say जी कि सर मुझे थोड़ी घबराहट हो रही है, ठीक है, एंड मुझे थोड़ा सा बोझ फील हो रहा है और घबराहट हो रही है, और ये मेरी जो है ना बाजू के अंदर वाली जगह साइड पे सारी की सारी दर्द हो रही है, सो it's a sign that he is having the coronary artery disease, or if it is more severe, then you can say that he is going to under the heart attack. ठीक है जी? It's a myocardial infarction हो रहा है. Is it clear? Right? So the importance of the intercostal brachial nerve I told you. ठीक है? So the anterior aspect of the chest wall, I told you, it is supplied by the lower part of the pectoral region. It is supplied by the anterior cutaneous branches from T2 to T6, and on the lateral aspect from the T3 to the T6. Is it clear? अच्छा, एक और बात, अब आप मुझे ये बताएं over here कि ये आपका sternal angle के ऊपर का जो region है, that is supplied by the C3 and C4, ठीक है, और उसके नीचे का जो region है, that is supplied by T2 to T6. तो इसके दरमियान में C5, 6, 7, 8, T1 किधर गया जी? हाँ जी, कौन बताएगा?
सर वो एक्सिला में चला.
Yes, you see here that these are going to make up another plexus. C5, C6, C7, 8, T1. These are going to make another plexus that is called the brachial plexus, and it passes through the cervical axillary canal I told you before. ठीक है ना? बताया था ना आपको? Which is just going to enter into the axilla and is going to form the it's a nerve supply to the upper leg. ठीक है? Is it clear? कोई प्रॉब्लम तो नहीं है जी? Okay, we'll talk about the cutaneous vessels. ठीक है जी? Now, The cutaneous vessels likewise, they are also accompany the anterior cutaneous nerves and the lateral cutaneous nerves. ठीक है? Is it clear? So the anterior cutaneous nerves के साथ जो vessels accompany कर रही हैं, these are